It's on and we're on. Well, welcome everybody. November 4th and COVID, big topic today, I think. And I visited with licensing and a few centers and a couple of directors, and we're open to any other topics that we might need help on or guidance on this week, but thought we maybe reach out to try to get clarification, help, strategies to help everybody get through this this winter, as this looks like it's the last week of fall before the cold snap. So yeah, and if you are a provider or a director of home or center, drop a number in the chat. Going to give away another Amazon gift card. Today is $25 Amazon. So drop a number in there. We'll ask Siri for a number in a little bit. One number of 1 to 100. So let's jump in. Now, you might have noticed that we have a new agenda format. And for many of our presenters, I've shared this with them. And so they're able to go in and input their topics that they want to speak of. So it's a little bit more interactive agenda. I think that's going to work really great. And if you're watching this on Facebook or you're here, our intention is to share this living, breathing, if you will, agenda with everybody that's a participant in these calls. And we'll put you on as a commenter. So, so look for this Directors Network agenda to be shared as a Google Doc. And look for the permission of being able to be a commenter. So you're welcome to look for this agenda. And if there's a topic that looks interesting and you have a question about it, you could just right click and comment on that. We'll have a comment box somewhere on the agenda for you. So this way, providers, if you're a home provider or a center or director, you can see the agenda in advance and you can comment, you can ask questions. And that way, whether it's licensing or Stephanie Bivens or someone with PCF or anybody, they can kind of see those questions in advance. So we thought we'd turn this agenda into a little bit more interactive. So look for that email and maybe bookmark that for you. So, all right. Well, we've got Mesa County Child Care Specialist updates at the top. So why don't we throw the mic over to Daisy and Morgan. Looks like Daisy and Morgan. So.
Yep, it's us today. It's who you get. So we have been discussing with epidemiology and the health department a little bit about the 15-minute exposure with the contact time. And so we had some clarification come back to us. The 15-minute exposure is going to be cumulative. And it should have been cumulative from the start, but I'm not sure that all of the investigators were following that. So it's not going to be, where they reach an 11-minute mark and then they walk away, so that clock restarts. It's going to be 15 minutes cumulative of coming in contact with whomever they were around. So when it comes to policies and procedures for quarantining staff and children, you really want to talk to the epidemiologist when it comes to that, because they are going to be able to tell you who and for how long needs to be quarantined. Does anybody have any questions on that?
Can we talk about the difference between someone that is exposed, someone that was adjacent to an individual for within 6 feet for 15 minutes in a day period? Can we talk and kind of get some clarification on the last contact and that exposure and the quarantine of 14 days? And then also, and kind of contrast that to an individual that was positive. And because I learned in the middle of this, got some clarification on someone that was positive, about 10 days they could return after first symptoms. I believe I'm close on that. Can we offer some clarification on that?
Maybe. I think I'm struggling with your question a little bit.
Okay, so my question is, if Janice was confirmed positive on November 5th or November 4th today, and her symptoms began on November 1st. So on November 1st, she woke up with a headache and a fever. She went in, was tested on Tuesday. Results came back Wednesday. When can Janice come back to work?
It is 10 days from her symptoms starting. Right, Morgan? Did I say that right?
She's not.
Sorry, I had to unmute.
Yeah, sorry. Yes, 10 days from when symptoms start.
Yeah, that's generally when they start counting them. If she still has symptoms, they would say not to come back until those symptoms are, I think 24, is it 24 hours now? It's changed so many times. I think it's 24 hours until symptoms end, so.
Kind of like when kiddos have the flu. I mean, treat this similar to when kids have the flu or anything else, and they need to be away from your center and fever-free for 24 hours without medication.
So symptoms began on the 1st of November. So she's out probably through the 10th.
Mm-hmm.
If she's symptom free on the 11th, she could come back. Of course, if she had a fever on the 10th, we'd want to go 24 hours fever free. She'd come back on the 12th. I had a conversation with someone, and I felt like that conversation was they could come back if they had mild symptoms, so long as they didn't have a fever, because some of these symptoms can last for weeks and weeks and weeks, whether it's a headache or maybe I've got a little bit of muscle ache, that kind of thing. Can you clarify on that?
What do you know about that one, Morgan?
I do think that you are correct in the fever-free, as long as it's been 10 days and they're fever-free. I think that if they're having severe symptoms still, say they're having a cough and body aches and loss of taste, say they have like numerous symptoms still, I would say likely just keep them out to be safe until some of those symptoms subside. But we do look for the fever-free because fever generally means contagious. So, if they do have a fever, you don't want them coming back. But I will have to check in on that with our contact tracing team just to make sure that, if they do have some symptoms still, that it's okay for them to return. I would think so, because if you think about the flu, you could still feel fatigued for a while. And you're no longer contagious. It's just your body trying to recuperate from that illness. But let us double check on that, because I don't want to stand firm and say, yes, absolutely.
The list of minor symptoms that we have, I mean, it includes nausea and vomiting and diarrhea. And so I'm not sure that I would just lump it all together and say, if you still have minor symptoms of vomiting, to allow them to come back to work. So yeah, let me write that down so that.
Yeah, I wouldn't think that I would want to go back to work if I was throwing up. So just try to keep them out.
Right.
Yeah, and something else that made your question, Kirk, that spurred my thought is a lot of times the positive person, whether it's a kid or an adult, usually can come back to work or to school before the close contacts can come back. So like you said, Janice got symptoms on the 1st and can come back on the 11th, let's say. But if she had been working for 5 days into that, all of those staff and kids that came into contact with her is then out for those for that period from that last point of contact.
Yeah, let's say that she was symptomatic on the 1st, worked through the 4th. Obviously, if they're getting tested, you're not going to have them working. But let's just say she worked through the 4th, found out she was positive, Well, actually, she worked for the 4th, then went and got tested that evening, was positive on Friday the 6th. Everybody that was high risk contact would be out 14 days from the 4th. So take that through the 18th. They could come back on the 19th. Yet Janice, if she's feeling great, could be back as early as the 11th. So when we're thinking about staffing, we need to think about this. I learned this a little bit in the middle of that. I could have brought my staff member back a day earlier, but so be thinking about this if this ends up in your center or when. Okay, those dates all sounded right. You ladies are nodding.
Yes.
Can you, sorry, Kurt, can they
Go
also
ahead.
clarify then? Because that was all related to somebody with symptoms. So what if they don't have symptoms but had the close contact? Then are we on the 14-day? So like if they live, like if their mom or dad tested positive, whether they had symptoms or not had symptoms, the parent, if the kid is symptom free, do they still do the full 14 days?
Do you want to answer that?
You go ahead and answer that because I think
Yeah.
it's changed.
So if their parents are positive, they would have close contact with their parents since they live with them. And the reason why we ask for that 14-day period is because it has up to a 2-week incubation period, meaning that they could start showing signs and symptoms on the 14th day even. So you don't want them to come back any earlier than that, just in case, they do start, the incubation period is longer for that individual just for some reason. So yes, they would still have to stay in quarantine for the 14-day because it would be a high risk contact.
Okay, but what if the kid actually shows symptoms and has symptoms like the parent does, then do they have to do the 14 days or can they just start the 10-day count from when they started their symptoms?
It would be that 10-day count, just like the staff members.
Do we have the assumption that the child was tested or no in this scenario?
Well, if they were positive, I'd say that they'd have to be tested. If they weren't, and they were in contact with them, then they'd have to wait the full 14 days. They could be asymptomatic, and be tested and be positive. So then they'd wait the 10 days. But if they didn't get tested, we would ask for them to wait that full 14 days.
Yeah, so the way to shorten it from 14 to 10 is get the positive test so you know, and then count back to that child's symptoms. Yeah, good question, Joy. I had a good
Any other ones?
I forgot it. Especially if you're on the call and you've had experience, and if you've reached out to licensing or health and you learned something, you had some good discovery, please share, or ask that question so that licensing could share. So we, I think the more we're prepared, the better. The more we know about the 10 days or 14 days, symptoms, exposure, that kind of stuff, I think it's going to help us, because I anticipate everybody's going to see some of this.
And what we are realizing, and we've kind of realized this much earlier than now, is that every center is a little bit different, because you guys all run just slightly different. So there is no overarching rule when it comes to how many classes and how long you guys will have to close. So really working with epidemiology and us and whoever is in charge of that case to make sure that you guys have all of your information and that you've given all of the information so that we can help you guys stay functioning. It's a big goal.
Yeah. So in a second, I want to hand it over to Melissa. Melissa Sherlin joined us so that she's going to kind of talk to us about some CCAP procedures and what you can do to make sure that CCAP gets what they need and you can get paid for those COVID absences. Something I was going to throw in between there. And then, so maybe we could do that, and then we can come back to some strategies. I would love to talk to providers about strategies. That's what it was, of what you're doing to minimize contact, what strategies are working for you, so that if you have an individual, child or adult, that tests positive, how you can minimize the exposure to others. I think some of that would be helpful for especially centers with between multiple classrooms and so forth. And so got a lot of other things on that. We can talk about masks and so forth. You know, I had an interesting conversation with Daisy about masks. So we'll stay on that because that's really a licensing topic. One of my questions was, we have a child in a classroom that has been identified with a speech, I guess you'd say speech disorder, or a special need. They're identified as someone who needs speech services. And would a staff member be required to wear a mask when you have a child in your presence, whether you're speaking to them or speaking across the room or speaking to the children? You know, there's things like ADA, Americans Disability Act, that we don't want to prohibit anyone's, adult or child's, ability to learn and grow. And so the answer that I received with that is no. So obviously we've all heard about the one that if you have a health concern. Daisy, you want to clarify those two things with me? Just to
Yes,
pull that out.
absolutely. So it's a gray area.
Yeah.
When you have people who have a health concern, whether it's asthma or trauma regarding a mask, that falls into a completely different category that I am not equipped to speak on. I'm not a lawyer or anything like that. But then also you have students who are hard of hearing and who may need to read those lips. My suggestion for that is, when speaking to them or providing them specific instruction, trying to distance yourself enough so that they can hear you as well as read your lips. It's such a fine line. I know you guys are walking, but also allowing them the ability to grow is so important. It all just kind of falls into that umbrella of your ADA concerns for kiddos and staff. With the health department, everyone is required to wear a mask, 5th grade and up, basically. It's recommended anybody 3 and over to wear a mask, but that's our recommendation. I think that working with that family, working with that kid, working with your staff to come up with a plan of what that should look like would be crucial.
Yeah. So just good for us to be conscious and aware of that, of an individual. And we've all heard this, because this is really the main one that came out at the beginning, that if it poses a health concern or something like that, but then also communicating with children with special needs. So even those that are wearing masks, I've encouraged my staff, that if you have a child that has a hearing disability or a speech impairment, something like that, just be conscious, and really try to teach and communicate to that child's needs and ability. Okay, I want to jump back into strategies in the classroom and that kind of stuff here in a little bit. Does anybody have anything specific for licensing? And then if so, please speak now. And if not, we'll send the mic over to Melissa.
Joy
There's
actually asked a
couple
question.
Yep.
Oh,
A couple
okay.
came through the chat.
Yes. Joy, you had asked about a sibling in the school district that is required to quarantine because of close contact in the class but has no symptoms. So is this obviously the siblings at the school district, but the kiddo that is the sibling, is at your facility, is not required to quarantine. At that point, they're like third down the line.
I might have misheard the question. A student in a classroom that was in high contact was required to quarantine by the school district.
Mhm.
This child might be an before or after school ager within a program at your preschool. Are you saying they do or do not have to quarantine with regard to your preschool?
No, so there's, let's say, an 8-year-old that is in second grade and is at school and has a sibling who's 4 and is at your facility. The 8-year-old has been quarantined because they came into close contact. The 4-year-old does not have to quarantine unless they start exhibiting symptoms, or unless that sibling starts exhibiting symptoms.
Clarification, because quarantine is quarantine.
Yeah.
Because I've had parents ask me like, well, they have to quarantine from Shelledy, but can they still come to your program? I'm like, no, quarantine is quarantine, but the sibling of that 8-year-old who's 4 does not have to. So yeah, great clarification.
Yeah.
Was there other questions in the chat we need to address?
There was one more that says, what about, and maybe that answered it, what about in cases of multiple exposures found out after someone is in the middle of quarantine? What about siblings and family members while parent is in quarantine and no test results yet?
What about multiple exposures found out after? The multiple exposures, are they related to the person that's in quarantine? Like not like familial related, but they were exposed to that person in quarantine?
I would think a 14 would end up being, well, yeah, with the, okay, let's say that Janice had symptoms January 1, positive on the 4th, and an individual was quarantined because she had exposure with Janice on the 4th of November, but then had additional contact with individuals and multiple contacts after the 4th.
Well, then she wasn't following her quarantine recommendations and it's going to push it out.
Right. So I guess if she quarantined, then her husband was positive, and then maybe a child was positive. It's a good question. It's a compound question. Just you have to go on that last date. I mean, I don't imagine that people are quarantining or literally quarantining in their house away from their family members.
You don't see that often. I do know of some people who have just because their jobs kind of relied on that. So, you know, husbands and wives have slept on completely separate floors.
Yeah, I have 2 of my neighbors, but he was positive.
Yeah.
So he did it complete. It wasn't a high contact or high risk. And he didn't even crawl out the window, go out in the backyard. I'm like, you're crazy, man. I had to take the screen off him and in and out. Under my door. Okay, good question. What about siblings and family members while parent is in quarantine and no test result yet? Well, they're secondary, or they're third down the line, right? Children would not have to quarantine if a parent was required to, because that sibling never had high risk to the other person. That's just like a sibling in your center. So if your preschool room, if a teacher is positive and you have to quarantine the entire preschool room, and that one of the preschoolers has a toddler sibling, the toddler sibling does not have to quarantine because they were secondary. They weren't around the teacher in the preschool room. Okay. And I've heard the conversation about, well, that just doesn't make sense. It's like if the preschooler's susceptible and been exposed, shouldn't the toddler? But I don't think CDC has never taken that approach. Mason County hasn't. And if we do that, then we just need to invest in close signs because there's going to be multi-generational tracing. So, but
Yes.
Again, great question.
And you know, the hypothetical scenarios are, and many of them aren't hypothetical. I mean, you guys are going through this. So your scenarios are all going to be very different. And so just give all of the information that you have to epidemiology. Let epidemiology give you all the information that they have. They will provide you letters of who can come and who can't come and who is close and who is low risk. So just work with epidemiology as much as you can. They are there to help you.
All right, I want to, Melissa was gracious enough in her busy day to jump on the call here. And then, so let's talk about CCAP billing, and then we'll jump back into like classroom strategies, center strategies, and so forth. So thank you, Melissa, for coming on.
Of course, I'm always happy to answer questions regarding CCAP.
Yes,
So hello, everyone. So just to follow up with what Daisy said is we did write a policy that we got approved by the state for Mesa County that we have a medical hold policy for COVID exposure or quarantining, because we do realize that if children are exposed and have to quarantine, that they cannot attend childcare for sometimes 2 weeks, depending on how that 14 days lands on the calendar, or 9 days, or whenever fits that situation. And we know that providers rely on CCAP in many instances in this community. And so we do have a policy that we got approved that we can pay up to 10 medical hold days, essentially 2 full weeks of care for exposure or quarantine. So, but we do need documentation from the health department. So like Daisy had mentioned, the families get a letter from the health department stating which children have to quarantine. Many times the centers or providers are getting that same letter or a variation of the letter. So we do need the documentation that with the child's name on it if possible, and the dates of quarantine, so we can pay those manual claims. And then we will make sure that providers are paid. We cannot pay if parents are self-quarantining their children. So say they hear that there's a child in school and they just want to keep their child home for 2 weeks. We can't pay unless the child has been essentially ordered to quarantine by the health department or their doctor's office and they're waiting for a test. So any questions on that?
I have a question.
Sure.
So we had a CCAP family recently that mom was showing symptoms, so she got tested.
Mm-hmm.
So she kept the kid home. Is that a situation in which we can submit for the manual for that?
Probably not, because she chose to quarantine her child. That child wasn't supposed to quarantine. I mean, she could have sent that child to daycare. She chose not to. So
Okay.
we had to stop the policy somewhere. And so we do need documentation that the child was under quarantine or due to exposure or positive test.
Okay.
If I have a question, if
Sure.
that happens, is it just 1 2-week period that you are allowed to pay, or if it were to happen multiple times?
Well, it would be per exposure.
Hey,
Yeah, I mean, if 2 months down the road, this child is exposed again and has to quarantine, we would most likely pay that. I hope that doesn't happen. Goodness,
I know.
those poor families can't get to work.
Well, but
Never.
I have a
I can see where a preschool classroom may have to quarantine in November, and then all of a sudden they got to quarantine again in December. So I could see that, and that child will be required to quarantine for 2 weeks in November and 2 weeks in December.
Well, and yeah, I mean, it's in our allocation that we would be paying for this child, whether they were attending or not attending. So I mean, we're doing this, number one, to be supportive of families because we don't want them to get a bill.
Right.
But the main reason is we want to be supportive of providers because we do know that COVID has, really affected all businesses. And
Right.
so we're no longer doing the medical hold like for strep throat or pink eye, that sort of thing, because we chose to pay 2 absences per month per child for level 1 and 2 Colorado Shines rating, and then 3 through 5 they automatically get 3 absent days. So we realize that those absent days are getting paid through the system anyway, and it's just a lot of extra work for everyone to do the manual claim and get the doctor's note. And so we're just choosing to pay automatically through the system for that. Any other questions regarding CCAP?
Lori, did you have one or did it get answered?
I did. I just typed it in, but so mine is, are we getting paid for the days the kids are waiting for the test? So if they come back negative, they had to wait 4 days for the test, it came back negative. Those 4 days that they were waiting, is that paid for on CCAP
It's
kiddos?
whatever the quarantine note says.
Okay.
So what if a
So
child
if the health department comes in and says, like on the 19th, these children were all in the classroom that were exposed, they need to quarantine for 14 days. We'll take the date of the letters have a date on them. It's pretty specific. So we're going right off of those notes. So
Okay.
if you have a parent that it has an issue, ask them for a copy of the letter.
Okay.
Because
Thank
the
you.
health department isn't releasing that information to us because of HIPAA. So, and the other thing I will say is it is helpful when providers tell us this information because sometimes, and very rarely, but sometimes parents are trying to send a child to a different daycare. And we would prefer to know that so that we don't approve care and then your center or home is infected as well. Many times parents do the right thing, but unfortunately, sometimes they panic because they don't want to not go to work or they just don't know any better. And so they do try to go to another center.
What if a child, I just want to piggyback on Lori's question. If we have a child in our center, parent calls us on Monday morning and says, little Joey came down with a fever on Saturday. Fever remained on Sunday. He says he can't smell anything. Doctor said you need to get him tested. So now here in Mason County, we can't test till Tuesday at the fairgrounds. So she tests him on Tuesday, comes back on Thursday, and let's say the results were negative. Would that not fall under?
Well, the doctor can give a note for that he's recommending
Got it.
test, you know.
And that doctor's note would suffice.
Yes, a doctor's note or a health department note.
Got it.
So Daisy, maybe you know the answer to this question, but is the fairgrounds the only one that are testing right now? Can't you just go to your regular doctor and get tested?
Yes,
Yeah.
actually from personal experience, the pediatric office, Western Colorado Pediatrics is also testing.
Yeah.
And at the time, this was probably 3 months ago, they were actually faster than the fairgrounds, but I know the fairgrounds have really, they've changed who they're working with, and the fairgrounds are like 3-day turnaround time is what I'm
Right.
hearing.
Yeah.
Because I've been tested at community, not because of an exposure, just because to go to the doctor. And they just tested me right there on the spot. So,
Yeah.
Yeah, I mentioned the fairgrounds on Tuesday. I had I'm aware of someone that was needing to get tested. They called Appleton Clinics and they said, yeah, we'll test you. It's like about $100 to get tested. So they chose to wait till Tuesday to go to the fairgrounds for free. So that
Yeah,
was kind of why that
could be.
question came up.
yeah, I don't know. I don't know if it's like a flu shot where the insurance pays for it or they don't pay for it. I have no idea.
Yeah.
But
So if, let's say ABC Learning Center gets a phone call from Mesa County and they say, hey, there's an individual in your center that needs to be, that tested positive. So we're going to work with you now on figuring out the quarantine procedure for individuals that were high risk contact. ABC Learning Center, that owner director needs to make a list of CCAP kiddos that the names and get that list to CCAP ASAP.
well, actually, they need to work with the health department first. So the health department's going to dictate.
Create the letter.
Yeah.
Right, but
The health department's going to dictate who gets quarantined, and then they'll send the letter to the center. And then
correct.
in some instances, it looks different. We've seen letters from the health department with every single quarantined child's name on it. And we've seen where it's just like this classroom and the names aren't on there. And we realize that we've received the list from the center. So there's not a one size fits all, but at the end of the day, we need documentation that the health department or a doctor's office ordered this quarantine.
You got it. So either that letter from the health department with the child's name on there, or because of HIPAA, sometimes that doesn't happen, the letter from the health department along with the center providing a list of names so that you know who to pay for.
Right.
You got it.
essentially, yes.
You
And
got it.
then the absent days are automatically paying out. So then we pay the first 2 absent days of that we'll pay under the absent day policy, and then we'd pay the remainder. It just depends how it lands on the month. And so
Yeah. And
it's a tremendous amount of work. I can't tell you how much work this is. So 5 people touch a manual claim in our office before you get paid. So
right. And so from personal experience, we got paid 1 week. We saw our absent days. The end of the week didn't get paid for children that were in quarantine because that's got to go through that manual process. So
Right.
just be aware that that's going to take a
Right.
little bit.
And we have to wait for because Chats pays 2 weeks out, we have to wait for those payments to actually show up to verify that you haven't been paid by the computer before we can even start a claim.
Got it.
So we're not like the first day they miss, we're not paying you because we have to show our accounting office that you've missed the payment,
Yeah.
which takes 3 weeks.
Yeah. So if we're looking at this week, let's say your kiddos were quarantined through November 6th, payment's not going to happen until probably the 19th of November.
And not even, we'll wait for the whole month at that
No,
point
no,
because
that's
we'll
regular.
make sure that there's no other days, and then we'll pay the whole month. So we won't be even working that claim until the second week of December at the earliest.
Oh, wow. Okay. So it's that far out to look for those manual claims. Good. It's good to know.
Yes.
Good to know. Great.
Mhm. Yes. Just because the minute that I submit a manual claim, it's kind of a one and done. And then if there's another day in there that the parent doesn't swipe correctly, or there's a sick day, or there could be anything that happens, we have to start the whole process over again. And so because our accounting team does this for us, we do 1 claim per month per child.
Got it. Okay. So any quarantine claims in November will be will wait to be submitted in December for that reason. So that's just good
Yes.
for providers to be aware. So they're not looking at the end of November and waiting and asking
No.
and making phone calls. Just be patient on the quarantine manual claims.
Yeah.
Got it.
But we get them done the first day we can, but my team has to set them up, then I have to approve them, then I have to send them to accounting, accounting has to enter it, then another person has to triple check our work and enter it into the system before you get paid. So that's 4 people here and you're the 5th. So 5 people touch this claim.
Got it. All right. Any other questions, clarifications needed from Melissa? I really feel like a lot of this is going to be helpful for providers so this will be really good.
Well, and when this happens, they're panicked. They call because they realize they're going to lose income. So please always call me. I will be happy to, just say, we'll get this taken care of. We'll do what we can do to be helpful. So,
You got it.
any other questions? I do want to say we have a large supply of size 4 and 5 pull-ups and size 4 diapers. So Jessica and Amy from PCF are going to assist me with a diaper drive-through. So please email me if you have any families that are in need of size 4 diapers, 4 and 5 pull-ups, boys and girls. They're decorated in boy colors and girl colors. So let me know how many boys you need and how many girls you need. And then we'll set that up for you to come and get them for families. Okay.
All right. Thank you, Melissa. Appreciate you being here. Hey, let's jump back to, there was a few other things that that Morgan and Daisy put on their agenda. You had visitor restrictions, essentials for children, updates, and openings. Do either one of you want to touch on those?
I'll talk about the visitors. So visitors are still highly restricted at centers. The only people that should really be coming in are speech therapists, occupational therapists, anything regarding that, and licensing or health if necessary. And we are trying to stay out of there as much as possible. So like Stephanie is not going into centers. CDA coaches should not be going into centers. Photographers should not be coming into centers. whoever else you guys might invite. I mean, and truly parents should still be doing curbside pickup and drop off. Yeah. Any questions or pitchforks?
Pitchforks welcome.
I have no pitchfork, but just a clarification for the CDA, the observations are not supposed to happen right now. There should not be PD specialists coming in to do those observations. There is, and I was going to touch on this later, but I can go ahead and talk about it now. But so even any PD specialists are still not considered essential workers. We do know that the CDA has that timeline, but the CDA has stopped their clock. Sorry, I have an angry mother cow behind me that you can probably hear. So anyways, the state has a waiver now for people that are in that limbo period. So if you have a participant, someone that has applied with the CDA Council, they have completed their 120 clock hour training, they have their hours, and they have taken their test, and all they are waiting on is that PD observation, PD visit, observation visit, it's called multiple things, but basically that person to come do the approvals. Those are not allowed right now. The CDA Council is not allowing virtual visits, but we cannot do in person. So the state has a waiver available right now for folks in that limbo period, and that applicant is the person that needs to apply, not the center. It's tied to that person. So if you have 4 people in your center that only need their PD visit to function as a lead, they all need to go apply. It's a very quick, simple process. And basically the state just needs records of who these people are and when they apply so that they can pay attention to that 6-month date, because it is for 6 months, but they are willing to extend that period depending on what 6 months from now looks like. And the CDA Council, their clocks are frozen right now for anybody that applies from before 11:30, I think, the end of this month. If they apply now, they're extending that 6-month grace period for their side. I think it's through June, but that was posted back in March. So I'm sure they'll probably reevaluate depending upon what's going on, because they are supposed to, once they've taken their test, supposed to get that observation visit done within 6 months. So that has been extended, and then the state has the waiver for folks to be able to function as a lead if that's all that they need. Sorry, that went further than the visitor.
Just to piggyback off of what Stephanie said, anybody who does apply for that, you have to pass that test. All of that documentation that shows that you are ready for your observation, you have to have a passing score on that test. Not just that you took it, but that you passed it.
So actually, Daisy, they won't tell you that you've passed the test until
What?
you've had your observation visit. They won't share that information at all. So they have to have taken the test. Because
sorry, I
if you do the
misspoke.
test or the observation visit, sorry, it's confusing. They won't share that information with the participant. If you do the observation first and then take your test, they won't let you know if you passed your observation visit either. It's either one. They don't share until both are done. Then they give you the unicorns and rainbows.
That's really interesting. I feel like that could be done a little differently.
There's a lot of things I think could be done a little differently, but I'll be quiet.
Me too. I'm done.
Or do you want me to go ahead and share the other updates? Okay, so for Essentials for Children, we sent out a survey, both, I think we sent it through email, and then we also posted it on Facebook for families to take. So that's kind of a demographic survey for us to collect information on where the gaps are on shared services. And once they complete that survey, they'll receive a gift card. We're a little bit delayed in getting those out because of because we're the government and that's how funds work. So with that being said, they will receive a $10 gift card. We have received, I think, almost, I'd say 140 to 150 responses so far. So our goal is to end up getting 600. We'll keep it open up until we receive the 600. So it may be open until July or August, just depending on how quickly people are responding. But we are sending out a $10 gift card. It's through Tango. So they actually get to choose their own gift card and what they want. So there's things like TJ Maxx, there's Walmart, there's Safeway. I don't think there's a City Market one on there. I think there's movie gift cards. There's a ton of different choices that they can choose from. So it does have a lot of different options. There's restaurant gift cards as well. So if you haven't gotten those out to your families, let me know. Or if you need the link, let me know. And then if you could send that survey out to your families, that would be great. We are also working on getting resources out to centers. We created a one-pager with a lot of different resources, not just the main resources, and it talks about what each service offers. So our big goal in this is, you know, for you guys would be to help bring services to the families that are in need. In turn, that will hopefully, you know, decrease absences. So it'll decrease absences, hopefully help with, you know, engagement in the child's energy levels, trying to help with stress levels of families. So there's a lot of different services out there that we would love to share with everybody. So if you haven't responded to that survey, we also have a provider survey out. If you haven't responded to that, let me know. Or if you're just, you know, interested in engaging in this, let me know. And then we're also posting on Facebook as well. Right now it's once a week. And this month is focused on WIC and what WIC is, hoping to educate, you know, those centers who do have contact with children and families to hopefully help you guys help your families and be able to speak to these programs and know what they are and be able to, you know, kind of offer them up to your families. The CACFP side of things, Mesa County Public Health is increasing our CACFP sites from 7 to 10. This last year, we had 3 sites on for the entire year, and we reimbursed over, I think it was $154,000 between 7 sites. 3 of those sites were on the entire year. We are, I think, over 50% went towards staffing costs as well. So it definitely helped a lot for the staffing costs. So if anybody is interested in CACFP, let me know. There are also other sponsors such as Wildwood for centers, and there's home sponsors. We don't sponsor homes, we only sponsor centers. So if you're interested, let me know. We are trying to increase our total CACFP sites, including homes, to 10, and Mesa County Public Health is taking 3 of those, or it will take at least 3 of those. So if you have interest, or if you know anybody who is interested, reach out to them and let them know they can contact me, and I'm more than happy to refer them to another sponsor if they don't want to go through Mesa County.
And I want to add too, on the CACFP, when it comes to ROMs, your records of meals served, I've got a great tool that I love to give to you and share with you it saves hours and hours per month that we've used. Basically, you may have seen some of my classroom rosters, and we've got it dialed in where it just creates your ROMs for you, and it shades in the time of the day that kids are scheduled. If they're scheduled to eat breakfast, it'll shade it in for you, and lunch and snack, and only on Monday, Tuesday, Friday, if that's their schedule. It's so nice. And it's all automated. It's wonderful. My staff love it. And then if they have a kiddo that dropped in a day and they had lunch, it's not shaded, so you know. So it's terrific. So if you're concerned about all the documentation and all the paperwork that's required for CACFP, if you're already on it, reach out if you need any help or would like me just to share with some stuff with you. If you're thinking about getting on with CACFP, reach out. I'd love to show you how it's helped. I'm telling you, it saved hundreds of hours, thousands of dollars a year. And love to give it to you and share it with you. So, oh, I'm going to throw this out there too. So about 2 years ago, I was part of one of the challenges with CACFP for me is getting parents to share their income because, of course, our meals are included in our rates. If they were below, the threshold for reduced, right? To qualify for free and reduced, where we might receive $3.50 or $5.25 a day instead of, let's say, 75 cents for a family with a child that eats 3 meals in the day, right? So the more we have in free and reduced, the tremendously significant amount more reimbursement you receive. So we actually discounted our rates for those that qualified for free and reduced, kind of like a low income rate discount. And so here's my pitch to my new families. And I asked them, I said, hey, we do have a discounted rate available also if you qualify for our free and reduced food program. And I just point to the chart and I say, how many members do you have in your household? And they go 4. And I said, is your income above or below $54,529? And they go, well, it's below. I said, wonderful. We'll just check this box and fill out this form, and you're going to save $2 a day on our full day rate, and $1 a day if they're on a part day rate with us. So it incentivizes parents to share their income with us and make sure they get on that free reduced program. The net gain is better. So if you're charging, let's just say $30 a day, and if they're paid, you're going to earn $30.75, let's say. If they're reduced, let's say you get a reimbursement of $3.25 or $3.50. You reduce their rate by $2 a day. Now you're getting $28, but now you're getting $3.50. So you're actually getting what? $31.50, more than you would have if they were paid. So it's a net gain for a center, and it also helps out my families that are in that reduced or free financially if they're not on CCAP. So we just created that discount. Reach out to me if you want more information, but I felt like it was really helpful to our families that are on that bubble. They're private pay and they're on that bubble, and it helps the center as well. So this is a good way to beef up your free and reduced households. All right. Anything else for licensing or CCAP? Anyone?
If you guys don't have anything else for us, I'm going to jump off. I think Morgan was going to jump off too. So thank you guys for having us and hanging in there with us.
You got it. Daisy, Morgan, Melissa, thank you so much. Hey, Stephanie, do you have a few other things to chat about there?
Sure. Are there any questions about the CDA process, the waiver, limbo stuff?
Is there a possibility that we could put the applications for the CDA courses and the waiver on the PCF website? I know that Amy and Jessica were working on that. Is it already on there?
Yep.
Or do we have that attachment and download? So
Jessica, Amy, I know they were working on getting those things. Do you guys know the status of putting that stuff on the website?
Hey, so Jessica is organizing that page really beautifully. I don't think that the applications are on there yet, but it is coming soon. So hopefully by next Directors Network meeting, we can reveal those.
awesome. Do you want to throw just throw your website, the PCF website, in the chat for anybody? That'd be great too. So if you're watching this after today, you could go check it out, bookmark that page. And I know I had a chat with you ladies and was really excited because all of the resources, we're trying to make a one-stop shop for Mesa County providers, one-stop resource, if you will. So yeah, kudos for really working on building out that site.
Yeah, thank you guys.
As of right now, go ahead.
Go ahead.
My question is,
No,
as of Stephanie, What does it
Yeah,
look
go
like
ahead,
for the
Kurt.
next CDA cohort? January?
Probably January, February is when we'll probably do another one. And those are income based. We take around 12 folks for that one. And basically what it is it's a learning community. It's a time for, they get the scholarship, they get a CDA career coach or advisor basically, and a cohort of people to meet to kind of tag team together, just to band together, because we know that a lot of times cohorts learn better when they learn with peers and have that kind of structure. So that one, we run 3 of those a year, and then the other state scholarship is all the time, and that can be any program of choice. If they qualify, then we cover the up to $600 of the training fee, as well as the test or application fee that's $425. They get a career advisor, coach, whatever you want to call it, somebody to cheerlead you through and help you out. And they can choose any program, and it's at any pace for most of those. The one that we do locally, that cohort can go extended. We basically do that faster track to keep them on track and that kind of thing through that. And it is online curriculum that they go through for about 7 weeks where they meet together. Right now they are meeting virtually. We've offered up the Workforce Center, but at this case with COVID and with everyone's schedules, they preferred to just have those meetings virtually. They're not mandatory. They are just there for support if they want to, like, I haven't written a paper in a long time. Will you take a look at this? Or, how'd you tackle that and that kind of thing. So that's the next round. We have one cohort that's going through right now, and I think we have maybe 12 or 13 in that one. So the next one, will be probably January, February, and then the state one is open all the time. We're still taking applicants for that.
And then Stephanie, since on the state one, just to clarify, so if they start the state one, that's the self-paced, do they have to find their own program? Or is that something they contact you and they do it through you for?
So once they get accepted, and that's a really good question. Once they get accepted, or even if they're on the wait list, they could get accepted. We're still trying to work with those numbers. But once they get accepted, they will get a
called DeBeck Wi-Fi or internet. We'll be back with Stephanie in just after a short break.
The number thing now too, if you wanted.
All right, let's talk to Siri real quick. That's a great idea. Hey, Siri. Hey, Siri. Please pick a number between 1 and 100.
A random number between 1 and 100 is 63.
63. So Joy had 73. That's got to be the ticket. Joy, that's the second week in a row. How about that? Did she just drop off? I think she did.
No, I'm here.
Oh, there you are. Oh,
Hey, but since I won the last one, I would be more than willing if you wanted to default to the next closest number. And I need to go buy a lottery ticket because I never win anything.
All right, let's do that. Hey, Siri. Hey, Siri. Siri. Oh my, last time. Hey, Siri. Please pick a number between 1 and 100.
A random number between 1 and 100 is 74.
You need to go get that lottery ticket. The next closest number to 74 is 88. All right, Nancy, there's a $25 Amazon card for you. Enjoy. You need to get to the gas station right away. All right, so yeah, Stephanie had some challenges there. So a couple of my thoughts: preparing for quarantine, staff, children, how, what, when, where, why. We talked about the mask a little bit.
I can add something in, Kirk, that I didn't know we had a active agenda, but I'm on the CSBG board through the county. So it's a Community Services Block Grant that funds some of the CDA program and also funds a couple other programs in town. Right now we have money available through CARES funding for anyone, really any business, any entity in the Grand Valley that is serving people at 200% the poverty level or lower. So it bumped up from 150 to 200% of the poverty level. And you can apply for up to $5,000. You have to make sure that it's serving income-based populations, but it can be for any cost associated with COVID. So they have to be a reimbursable expense. So you will have to provide receipts to the county, but it could be for past expenses. It could be for something you need to do right now. But you can apply. It's a one-time application right now, but it's a real easy Google form. I'm going to put it in the chat box. We keep trying to get the message out. We actually, you have to apply by the 20th, but we do a monthly funding meeting. So if you apply by the 20th of the month, then we meet the last Thursday of every month to approve or disapprove or ask questions, clarifications. But it's really open to any organization. But I thought specifically one of our missions on the CSBG is early childhood education. And so we're funding all kinds of different things because it's COVID CARES funding specifically. But if any of the centers or home providers on here wanted to apply for that, it's available. It's a real easy, just Google form. It's a Google Doc, but it allows you to apply for funding, one-time funding. Again, for anything any expenses that have impacted you via COVID, but you have to be able to prove that you are serving that population. So say that you're serving, 25% of your kids qualify under that federal poverty level, the 200%, then your reimbursable expenses have to relate to that percentage. If that makes sense. So like you can't just say, but if you wanted to do a playground structure, or you needed, with the winter coming up, you wanted some way to, circulate air or anything COVID related, supplies, PPE, but they'll ask you for certain documentation of families that you're serving that meet that 200% of the poverty level.
Is there a threshold of families that have to meet that?
It's we're kind of taking it on a case by case basis. Yep. So, and it kind of varies, but we're getting applications and requests from all over the Valley. They keep trying to send it out, but with all the election stuff, the news media hasn't been picking it up. Their PSA from our board on this funding is available. So I asked them if it would be okay since, I guess it's kind of insider trading in my brain because I'm on the board, but they said it was perfectly fine. The information's going out. They were going to send me the PSA that was approved by the county, by Deanna and all of the county people, but they didn't. So I'm just going to put a link in the chat box to the Google form. But it's a really easy Google Doc. You just fill it out, and then Pat over at the county will follow up if they need more information. But you are going to have to provide that income qualification level. So if anybody is interested, does anyone have any questions on that one? You're still muted, Kurt.
She was hanging out in the waiting room, so we let her in. We'll let her back in here just for a minute, though. No, that's great information, Joy. We all are having expenses relating to COVID, and if you haven't been impacted with the quarantine yet, plan for it, apply. Yeah.
Well, and that is one clarification because we have had some centers that have applied. You can't apply for projected expenses. They have to be receipt reimbursable. So like you can't say, oh, well, we want staffing for 10 teachers in the event that we have a quarantine, because they don't want to give the money out. But that's why we do the funding cycle monthly, so that if you have, instead of refunding anticipated expenses, they have to be actual expenses that you've already incurred. So like for you, Kirk, with the quarantine, you might be able to apply, because you've actually had expenses directly related to COVID.
The quarantine.
With what?
I said, who told you I had to quarantine?
No one.
I'm kidding. I did. Okay.
So yeah, it has to be, it can't be an estimate. It's like, you can't just say, I want money in case I have to pay sick days, kind of a thing. It has to be something you've already incurred, or it's a specific fixed cost that you have to buy cleaning supplies on Monday. You will have a receipt by the time you get that funding, that funding acceptance or denial.
Got it. Okay. Great resource. So I'd just like to throw out, Stephanie, do you want to finish up there, since you've left Mother Cow in the pasture and come inside?
No, my battery died. Sorry.
Oh.
It's like, oh no, of course, right when it was my turn. Can you remind me of the question again now about the...
You were just clarifying about the CDA.
I had asked the question, Stephanie, on if they apply to the state one that lets them pick their program, how do they find a program? Or is it something that they can do through you at the county level?
Okay, so the answer to that is both, because I'm managing those efforts. But what happens is the way that trickles down is, so I'm managing, and then we have coaches I'll use this term, they're CDA advisors that then I give them the participants once they are accepted. Then our people that are the advisors get their names and contact information, and then those folks will contact them and guide them through the processes. At that point, they tell their career advisor which program they would like to use. They can use TikTok, they can use CARES courses. I have a whole list of what's accepted in the state of Colorado. There's a lot out there. So they pick their program, and as long as it is good in the state of Colorado, and it's under and all of the ones are under the $600 mark. We found some new ones that we've heard that are really awesome, that are super cheap. Either way, it doesn't matter, the state's paying for that piece. So they can already chosen their program when they talk to their career advisor, and say, I want TikTok, or they can say, I don't know, tell me what's out there. And that career person can help guide them through and take them through the list so that they make sure they find a program that's going to fit their needs. Because there's a lot of different ones out there. Then they identify if they want preschool or the family care or infant and toddler. We order their books, but they tell all this stuff to those career advisors, who then we put it in a sheet, and I work with Red Rocks to purchase all of that. Once they have finished their courses, they have their hours, and they still get contact with those career folks throughout all these processes to help them through. When they're ready to purchase their test, they share their client ID number with that career advisor, and then we can purchase a voucher that then the person will put the voucher code into their CDA account, and it will give them, and it'll come through email from info, your council, whatever. They put that code in there, and then that's how they purchase their test, and then they're able to schedule it. But those career folks are there for the entire process to help them through. Thank you.
Thank you,
Any
Steph.
other questions on what that's? Yeah, go ahead.
Oh, I just said thank you. Sorry, I probably didn't turn my microphone on in time for you to hear the thank you part.
Of course. Yes, ma'am. Any other questions on what that process looks like?
I just want to throw this out there
So
also.
there's multiple opportunities for CDA. Go ahead, Kirk.
TikTok training, if you've not been aware of that or looked that up ever, it just came up on my calendar today actually to check in with them. I always think about it as a Black Friday special, but usually in November they have grant money that gets given to them. So their CDA class, which is a completely online class, normally runs for $250, is now only $75 with. And it's this time of the year right now over the next probably few weeks. If you're interested, I type TikTok training. I'm sure it's tiktoktraining.org or something like that online. You can look it up. But you might reach out to them and see if they have that promotion right now where you can purchase those for $75. So historically, I would buy 2 or 4 in like November. And they're good for a year. So I'd be able to hold on to them for an entire year. So if you have a staff member that doesn't get into one of the cohorts or doesn't qualify for a low income CDA cohort or something like that, sometimes I would, sponsor that individual or give them a scholarship and give them a CDA class for them to take. I have a year to assign it to an individual. Let's say Jane comes in next June. And so I assign it to her in June, and then she has a year to complete that course in case life happens. So, and then of course it's $425 to finish. So I have someone that I did that with, and then she applied for one of the recent scholarships and was awarded, I think, up to $600 in scholarships. So she's, putting TikTok and the scholarship together, and she's going to get all that paid for her. So, so that was cool. So just want to throw that out there, TikTok, in case one of the other, that's just another CDA option.
Stephanie, can I interject here?
Oh, yes, go ahead.
I'm listening and trying to multitask here, and I heard you going over all this stuff. I know we've kind of gone back and forth on some things. Did you clarify just now for people like Liliana? We've talked about how she actually qualified for that scholarship. Will that coach be able to walk her through how to apply that with the voucher? Is that what you were just saying?
100%. Yep.
Okay, cool. She did just email me or tell me that she got an email from a coach, and that seemed to be a new thing. So that was nice to see. So thank you.
Mm-hmm. Yeah, of course. So that's that kind of support system to help guide them, just because it is a very confusing process. There's a lot of hoops, there's a lot of codes, there's a lot of just different stuff. And so having somebody there to support is part of this process now. And I was going to add to Kirk's point, for that scholarship, you can also, people can reapply for the state scholarship as well. And even if they're halfway through, so say they've already taken their training and they're just waiting on their hours or anything like that, they can apply for just the fee to get covered too. And there's no, they don't take one over the other because of what their needs are or where they are in the process. So those are all okay to apply for. So if, like Kirk's saying, he scholarshiped somebody to take the hours and then they reapply for that scholarship and get it, then they would get their test paid for. So, and then renewal fees are also covered there. With that one, they do not cover the cost of the program. There are free programs out there for the renewal for the 45 clock hours. EQIT is one of them. There's lots of them, but it does cover the cost of the 125 for when they're ready to resubmit for their renewal. So that state scholarship is for both of those. And then what else? There's another program out there that I found, and I'll have to look back through my list, but it's one that's $90 always. And it has 6 modules that they go through, and it was new to me, but I know that the folks over on the Eastern Slope use this version as well, and it's an online model too, and I'll have to get you the name of that one because I can't remember. I looked it up and it looked pretty nice. With the state, they get their competency book, which is the one they need for the observation visit, which is obviously on hold, but it's the book that is needed for TikTok assignments. They also get a book that I didn't even know about, that it was an essentials book, but it's huge and it has a lot of really good content. And then they also get a workbook that helps guide them through when they're working with their coach of like different things that they need through the line. So it's really nice. They get a whole three books that help them through that process. That's going to give them a lot of resources. Before we shift topics, the only other thing I wanted to mention was we are halfway through EQIT, which is Expanding Quality in Infant and Toddler Care. This is my first time teaching this content, and I'm teaching it with Kelly from ECN. It's going really, really well. We're gonna do this again in the spring. It's a free training. It is worth 20 or 45 clock hours. It can do a renewal for a CDA, and it can be college credit too. If you complete it, you need that certificate, and with certain colleges, they have different processes, but like with CNCC, they take an exam, and then they get college credit for that, which is pretty neat. I would have to say that EQIT, I would recommend people that work with infant and toddlers, if they're new moms or anything like that, it is really good information that might support what you're doing in your center, and then mom can be mirroring some of that at home. We do have some mothers, some grandmothers that are taking the class right now and are really, really liking it. So this class can be for not just teachers in centers or people working in homes. It can be mothers, aunts, uncles, people that are going to be working with toddlers or infants, and it's free. I highly recommend it for people. It's really good content.
Marvelous. Well, we've just about wrapped up. Does anybody have?
The only other thing I have one more thing. There's still opportunities for director scholarships. Get with me if you're interested, and I'm done.
Sounds good, and hopefully we'll get that application for that on the PCF website soon. So stay tuned to the PCF website. It's in the chat. Google PCF of Mesa County, you'll find it, no problem. Hey, just so you know, next month in December, I've got scheduled on a guest speaker. He's a manager of sales with Childcare CRM. So if you've never utilized a CRM, this will be interesting. I was turned on to that by Brian Dupree. He's the author of Childcare Millionaire. I actually interviewed him the other day. If you're following the Mesa County Facebook page, you'll see that video that we made of that, one of 4. And it was a great interview, but I had off-camera conversation with him talking about CRMs. It's a customer relationship management tool. And there's a company called Childcare CRM, and this is all they do. And it's all about pre-enrollment. So if you have ProCare, like I do, that's post-enrollment. That manages your center and your children. If you have, if you're on, come on now. What's the other ones? If you're on CORE or their, Colorado Shine software program, that's post-enrollment. So a CRM is all pre-enrollment. And I attended Chris Murray's virtual seminar. I was blown away. I was like, wow, this is really top-notch production. And I think this is the one huge takeaway I got. I spent $200 to attend her seminar. It was all virtual, and I walked away with the Childcare CRM, and I'm purchasing a subscription. We're onboarding it right now. They're making all my forms digital, literally from the very first time you pick up a phone and you get their name and their phone number and email address and child's name. that will flow right into your software. They're partnered with ProCare and other organizations as well. So, but waiting list is going to replace the waiting list that I've used, and it's going to digitize everything for us. So in the day and age of COVID, we need to make sure our center is full, and the time it takes to manage a waiting list and make those phone calls and keep in touch with your families is really critical and takes a lot of time. So I look forward to being able to share some personal experience on December, and that meeting is December 2nd. And I'll have either Mike or Isaac on to do a demo for us so they can kind of show you what that's all about. So really kind of excited about that. So stay tuned. Okay, well, we're about wrapped up. Does anybody have anything else? Any other questions, comments, shares?
I had put this in the chat and maybe people want to answer it later, but yesterday I met with our nurse consultant and she asked us what our quarantine plan was, if we have to quarantine a room, if the center gets closed for quarantine. And I really don't have a plan. So I wondered if anybody else had anything hammered out yet that they're willing to share.
Well, let me share this from personal experience. So we had to quarantine 2 classrooms. So we had eight staff that we identified as high risk, close contact, and 2 classrooms, which impacted like 50 children. So those 2 rooms were shut down, but we still had our 2 toddler rooms and our preschool room open. And so it was quiet. That's part of the plan. Get caught up on some paperwork and thinking ahead. So, I mean, we went through, we did a complete sanitation, like we just flipped the room upside down. We cleaned all the toys. We ran everything through sanitizer. We jumped into all this bookshelves and all of that. Extra staff that I had, I brought them in if I could. And so we did a super big cleaning. We fogged with our disinfectant, of course. So those rooms were ready and completely clean. So just your plan should be complete sanitation and disinfection of room. And then we took advantage of the fact that the room was closed. We painted both rooms. We redid our floors. We did the things during the week, Monday through Friday, that we couldn't otherwise do, with children there. And we didn't have to come out on the weekend to do floors and clean. So we buffed and waxed and that kind of thing. So that was our plan for the space. As far as part of that plan would be staffing, beefing up your subs. Right now, I'm definitely have a couple ads running to make sure I have a couple subs so I can have staff to come on, in case I have to quarantine other staff. So that's on my mind when I think about possible future quarantines. Does anybody else have anything to jump in on that for what that plan would look like?
I don't have oh, sorry, Lori. I was just going to say, we don't have a specific plan here, although because as per what licensing told us, and from when I've had to talk to the epidemiologist about potential exposure stuff, there's no way to plan for what they're going to tell your center, because it's going to vary by the case and by the situation. Yeah. So, I think you have to have a contingency plan but I don't think we can plan for every what if scenario with it, because it's going to depend on what kind of contact happened, when it happened, when the symptoms started. There's so many variables to it that I think you need to have in your brain sort of, okay, what's going to happen. But I don't think you can, in this particular case, at least in my opinion, I don't think you can plan for every instance. But I feel like our meetings and like Kirk sharing his experience, and anytime we have them, I think the more things we have, the more we can process it, so that when it does happen to your center, you at least have a leg to stand on. But we're at the mercy of the health department. They're going to tell you what you have to do.
And I agree with that. I think knowledge about the 10-day, knowing about the 14-day. I mean, I got a call at 2:00 on Sunday. I was ready to sit down and watch the Chiefs game. And then I spent till 8:00 that night working. Make sure you have an ability to contact parents. I was able to create a video, imagine that, and send it out to all my parents via email and text. Do you have that capability? Are you ready to do that? Tracing, be ready to trace. So you may have to go into your center or online, wherever your cameras are, and try to figure out. I mean, we just basically said staff and children in those 2 rooms done. But I guarantee if it happens again, I'm going to get specific, because I may have children or staff that were not in close contact, that maybe weren't in high risk. And so I'm going to be prepared to dissect that. We've talked about making a green team, red team, so that if someone over in the green team has to quarantine or test positive, the red team can still come and staff member. Now, from an early childhood perspective, that's not how you want to run a room. You don't want to divide it in half like we talked about back in March, April, and May. But from keeping staff working, keeping families employed and working, not losing their jobs, that's an issue. We refunded all of our tuition for our families. I can't do that all winter long. So, but families would have received 2/3 of their pay under the 400 hours of one of the federal acts for COVID. So maybe there can be a different plan on the second round or on your first round. So think about that. Think about what would you do with your private pay? You know what to do with CCAP, thanks to Melissa Sherlin. But what are you going to do on tuition if you have to shut down, 1, 2, or your entire program? Think about that. And I would love, feel free to give me a call, 639-4407. I'll put it in the chat. That's my home office number. And I would love to have dialogue with you, because, I love talking to people that are smarter than me, come up with better ideas and brainstorming on what to do on round 2 or 3 of something like this.
Okay, thank you guys so much. I do appreciate that.
Yeah. And
Sorry, it's not a good answer. Neither one of us gave you a very good answer, Lori, but that's where we're at, unfortunately. I'm just expecting that I'm going to have to close for 2 weeks. That's my contingency plan, because that's worst case scenario. So I have a plan for what that's going to look like, and then hopefully we can mitigate it and minimize it so that it's not a full closure. But that's the worst that can happen, is you have to quarantine or you have to close down for 2 weeks, essentially. I mean, in my brain. So
hopefully you don't have to close the entire
I get that.
facility.
And Kirk's comment, I hadn't even thought about having to reimburse families. So that's something that just did not enter my plane if we had to close down rooms and that. So thank you, Kirk. That was very stressful and gives me a whole nother.
I know, right? I know.
No, I'm glad you mentioned
You're ready for your staffing, to pay your staffing, because I had to pay 8 staff for 2 weeks. They weren't all full time. And now I've got to look back and go, okay, that cost me, let's say it cost me $7,000. When do I get that back? Not immediately, not the following Wednesday, because I didn't have enough taxes. So that could be 4 or 6 weeks before I get fully reimbursed. Yet I refunded $10,000 in tuition. Holy moly. Make sure you're ready or thinking about some of those, and maybe a full refund. If I were to redo it, I would have rethought that a little bit. I might have said things like, hey, this is going to be a long winter. If, I've got, let me know if you can hang in there with us for those 2 weeks from a tuition standpoint. If not, we're going to try to, secure some funding to give some scholarships to hold your child's spot. I guarantee you on the second and maybe third round of this, I'm going to be more creative with that, because, yeah.
Hey, Kirk, can I ask one additional follow-up question on that? So I know we talked about, I know we talked about at the last meeting, the whole payroll taxes reimbursement for that when you have to pay the staff members. Have you actually done that yet, in terms of how does that look in terms, is there a specific form you have to fill out so that they know you're not just delinquent on your taxes, but that you're actually offsetting the CARES Act requirements?
So I probably would have been able to answer that, but I'm so thrilled that I cannot, because I just outsourced beginning October 1st to Auto Paychecks, whom you met last month. And so they have a separate category in their payroll software that falls underneath. They have 3 categories for COVID pay. One is for the employees on 100%. Then you've got the FMLA under 2/3, and then another one, which is the 2/3. And so inside your payroll, you may have to simply add that category, that pay category, and then we put their hours in there. So some of them might have had 80 hours in that COVID category. Some had 10 hours or like 70 hours in COVID, but 10 hours that they worked in their normal category. So I would reach out to your payroll software and get them to help you create those categories, because it won't be in there, but it might be in an update. Like if you have QuickBooks and you did an update, it might already be there.
I would just tag on to that, Joy. I use the auto paychecks as well, and so that was great. I've only had 3 staff members I had to do it on, but one situation that I did have come up is that I had a staff member. She had no symptoms. She decided to go to the doctor anyhow. They COVID tested her since nothing else could be found. So I requested a doctor's note from the day the doctor's office notified her, because she didn't come back for 3 days past that. So I only had to pay her for the days she was actually waiting for those results, whereas she was going to try to get a full week out of it. So I did think it's really important you get the good documentation from staff members, as well as to when the doctor needs to let you know when they notified that staff member of their test results.
Correct. And knowing the 10 days. So I had a individual that was positive, and I didn't learn about the 10-day that they could come back until like day 10. Well, they were not available the next day to work, but they were cleared to work. So I did not pay them that 11th day because they were cleared but weren't here. Part of it was me, because I didn't know and they didn't know. They thought they were on a 14th. The reality is that day is banked for them. That's still, like, if they're personally impacted again, they'll get paid 100% that later. So let's say they got paid 9 out of the 10 days. So there's a 1 extra day out there for us. It's not like it's gone. But yeah, knowing that, so that knowledge is really important. And Lori, I'd love to talk to you more at any time, different time, about auto paychecks, because how long have you been with them?
I've been with them for 2 years now, I think.
Oh, wow. Yeah, we need to have a conversation. I'd love to learn more about your experience, because otherwise I can be a slow learner.
Sure, we'll talk.
Yeah, good. All right. 2:37, good stuff. We'll see you all.
Sorry to interrupt, but can I ask one other question?
No, once again, for the second time, like you didn't listen the first time, we're out of time, but go ahead. Amy.
Sorry, I have dance in my background. It's kind of like when a dance teacher says, let's do it one more time. They don't mean one more time. They mean 10. So I just was curious if anybody has had to go through this process, this really overwhelming process of getting interstate background checks for any of their staff members that lived out of state in the last 5 years. Because I spent almost all day yesterday and I barely got through 2 states. I mean, it was whenever I could actually get to a computer, but I have 3 staff members that were in states that don't participate in the National Fingerprinting Program.
Yes.
So I was just curious if anybody else had any experience with that yet, or if it's easier, maybe I'm not doing something right.
So I'll start by saying this. Let's put that on licensing. I'm going to put that on their agenda right now for December 2nd.
Okay, that'd be great.
Conversation, clarification. Okay. And the one thing I've noticed is that when you read the regs, and Nancy helped me read it really close, if you read it close, I don't think it applies to current staff. I think it applies to new staff, incoming staff. So if you hired a staff 8 months ago and they came from California, I don't think you have to do those clearances in California.
I read that different.
Okay, well, we read the regs and
let's clarify.
Yeah, let's get that clarification.
Okay.
Yeah, because I'm pretty sure that it's all staff, but let's ask the experts because they're going to know. But you do have a very large grace period of time to get all this done.
Right. And are these other states ready for that?
Well, I was actually pleasantly surprised. So I tried to start this when they started sending out the things. And then when we hit that September 30th deadline, they had nothing. And I asked licensing and they just kept referring me back to the Department of whatever the department, Colorado website is. and they had all their FAQs, but they had no way like to even go about it. So we did receive an email, I don't know, maybe 2 or 3 weeks ago that came from the Colorado office, not from our local licensing. And they have, if you click on the link to it, it actually takes you to a spreadsheet that has click options for every state. And it's actually pretty easy format. It's just super time consuming. But it's a really good one. I can send it to you, Kirk, if anybody missed it, if you want to forward it to everybody else. But it's a daunting process, to say the least. So.
Okay. Look forward to that. Sounds good. All right. So we'll get that on the agenda for these guys for next, I'm doing it right now. All right, everybody. I've got another one. See ya. Thanks for being here. A lot of good information. Have a great day.